question, which I think is going to go to Beth. Which opioids are seen to show the highest risk for addiction? For example, is there a difference between oxycodone, hydrocodone, morphine, hydromorphone, buprenorphine, tramadol?
Okay, good question. Yes and no. All of these medications have the potential for abuse. And so trying to differentiate between morphine, oxycodone, hydromorphone, it tends to be more related to the formulation or how the body handles the drug, what we call the pharmacokinetics of the drug, or differences in the formulation that can influence the effects of the drug. So for those drugs, we know that there's they all act on the same place in the brain, and if they're taken in high doses and taken in such a way that they reach the brain quickly, they all have a potential for abuse. Some of the medications that are a little bit different include what was mentioned with perhaps tramadol, that has a slightly different mechanism of action. In addition to interacting with these opioid receptors in the brain, it has another mechanism of action that may help lower the abuse potential, although people have run into problems with tramadol as well. Likewise with buprenorphine, it's thought to have, when given sublingually, a lower abuse potential as well, because of its action in the brain is what we call, it sort of has partial activity at this opioid receptor. And because it stays in the body for so long, it's tended to think of having a lower abuse potential, but it can be abused as well. So one of the reasons why you may hear about some prescription products more than others, such as the long-acting oxycodone product like OxyContin, is more related to its formulation probably, where you had very high doses of oxycodone in a tablet that was designed to be released slowly over time, over a 12-hour period, and sometimes people may tamper with that and crush it and either swallow it, or sometimes people would snort it or inject it, and they'd get a very high amount of drug going to the brain very quickly, and that sort of enhances the effect and increases the potential for abuse. So the question is kind of yes and no. They're all opioids. They all have a potential for abuse. There may be some gradation in there, but they all have the risk, and especially if people start injecting them.
Yeah, I hope that gets at the question. I mean, the other thing that I tend to think about when I approach the addiction question is there are people who are addicted to sniffing Pam and gasoline, and I recall in high school some colleagues who made extraordinary use of oregano and cigarette papers. So the pursuit of oblivion is achieved in a number of ways. And,
so maybe I can just comment on that again, because that's still on. Is that yes, you can find case reports in the literature of people abusing almost anything, or trying almost anything, or injecting pretty much anything, which is quite surprising. When we talk about the potential for abuse or the abuse liability of a drug, scientifically we're talking about specifically drugs that act in a particular area of the brain that can cause sort of euphoria or taps into a part of the brain called the brain reward system. And those are drugs that we consider to have sort of a higher potential for abuse, and opioids fit into that category, as does alcohol and cocaine and other drugs. Whereas other medications that affect the brain, like antidepressants or antipsychotic medications, don't work in that same area of the brain, and so they're not considered to be substances of abuse for that reason. However, having said that, people can tend to try or misuse anything really.
Now, the other question that came attached to that one was,